are really privileged today to have four of Michigan's leading legislators with us to talk about the key issues in healthcare in Michigan right now. Those issues are being considered in the state legislature, what things have happened so far, and the outlook for the rest of the session this year. So we have Senator Vanderwaal, Senator Brinks, Representative Langford, and Representative Witwer.
Whiteford, Witwer.
Oh, okay. I knew I was going to do that. Thank you. So I'm going to ask each one of them to introduce themselves, and then we're just going to have a conversation about what is happening in the Michigan legislature in healthcare these days. So let's start from the far end and come this way.
Oh, okay, great. Well, thank you so much for the opportunity to be here. It's always great to talk with folks who are working in the field that we are legislating about. Often legislators, as you are well aware, I'm sure, don't have as much experience in the field, and we're asked to make some pretty important decisions. So I've had the opportunity to serve in the legislature for the last 10 years, and I served all 10 of those years on the Health Policy Committee, for 6 years in the House, as well as now going on 4 years in the State Senate. So it initially was an incredible learning curve, and I would say that this is one of those committees where if you're not learning every single week in committee, you're not listening. So it's been a pleasure to be able to be part of the health policy discussions in our state, and it continues to be a very rewarding area of policy to work on. And I've got some great partners up here, so I'm very pleased to be here with them. When it comes to health policy kinds of issues, I tend to take a very holistic approach to that, and it's not just the things that we do in our health policy committee that matter to health, as you all know. We talk a lot about social determinants of health. We talk about, in my office, we do a lot of work on maternal and infant health. We talk about housing. We talk about food security. We talk about things like infrastructure so that people can maintain a healthy lifestyle and be able to get to those sources of fresh food and healthy activities as well as sustenance, right? Other things that we've worked on that are in the Health Policy Committee, and Senator Vanderwaal and I have had the opportunity to work on a number of those things together with bill packages, but prescription drug affordability has been a huge topic. We've passed some bills on that. I also have another package of bills that would help address that by establishing a prescription drug affordability board. You'll see legislation like that in a couple of other states as well. Senator Vanderwaal and I have worked on opioid legislation. We were part of a task force, and I believe Representative Whiteford as well was on that. And so there are 2, 3, 4 bills making their way through the legislature at this time. So we're hoping to see some success with that. Yeah, those are just a couple of the topic areas, and we can get into other things as the conversation evolves here. But very pleased to be here and pleased to be part of this conversation.
Yeah,
Senator Curt VanderWall. I'm fortunate to represent the 35th Senate District, which is northern Michigan, basically Ludington to Leelanau County, and all the way across the state to West Branch and Ogama County. And really what I was fortunate enough, I had a leader that said, you know, what would you like to do? And I said, boy, I'd love to have the opportunity to chair health policy, and he gave me the opportunity. And I think people said to me, what in the world did you get yourself into? And I think once we got started, we realized that we have a lot of opportunities here in the state. We have a lot of issues, and I think as we've worked through in rural Michigan, we know access to care continues to be a huge barrier with what we're doing in large of losing population. And it really makes it hard for our hospitals to be properly staffed. And with some hospital consolidation, we've seen some of those services be moved to main campuses. So we've really worked really hard together as a committee to try to bring back access to care in some of the rural communities. We've also worked hard on making sure that we give opportunities for our rural hospitals to be properly staffed with some Senate bills that Senator Brinks and I have been working on, and we have got passed, and the governor's made a law. So we're really proud about that. But what do we see in the future? What do we believe is going to be some main issues? And I think through the pandemic, we have found that we have a major mental health issue inside our state. And unfortunately, we're not prepared for that. And really right now, it's a challenge to our committee to come up with ideas of what we can do to hopefully rectify some of that and give some opportunities to make sure we address that throughout the state and in some of our more populated areas. And it affects not only our K through 12 students, but it also affects the adult. So we've been excited about what we've got done. I will say we had just a terrific committee today. I think that Senator Brinks would agree with that, but it went from nursing home opportunities to mental health opportunities. So we look forward to continue to work, and we love the suggestions that we get from every one of you in this room, and we look forward to continuing to do that over the next 8 months.
These are huge introductions. So I'm Angela Wittwer. I represent Eaton County. It's right outside the city of Lansing. I've worked in healthcare since I was probably 14. I was a candy striper at St. Lawrence, went to nursing school at what was Butterworth School of Nursing, and then I worked 22 years down the road at Sparrow Hospital, started in clinical care in the burn unit, then went over to rehabilitation and ended up in administration. They wanted someone that could bridge the communications between direct patient care or the physicians and the administration. So that was my fun job to do. I was never a politician, had no clue what was involved in it. They came and asked me to run because I was a community leader. And when I came in, the only thing I was told was to lobby to get onto health policy. So I did. I started lobbying to get on health policy, called in favors from a bunch of people that are leaders in healthcare around here, and they ended up giving me health policy. It is very nice, as Mary can attest, to have a background in healthcare so that you understand the language that's being said, and there's not such a huge learning curve if you've come out of it. It is a very complex, there's so many complex issues in healthcare, and it's been an honor to be able to serve all of the healthcare issues that we have. I also was appointed to the governor's opioid task force and her food security task force. I've worked in food security a lot over my career. And if you look at a pyramid, you cannot survive. You can survive without a house, but you cannot survive without food. So if you can't even give people that little minimum thing, then they'll have bad health care, bad everything. So I've been focusing a lot on making sure that our kids, our seniors, and everyone has the food necessary to live a healthy life. And then I work on other packages. I've been doing some not health issues. So it's been very much, it's been a pleasure to be able to serve people that I worked with my entire life.
Hi, everybody. So I'm Mary Whiteford. I'm a state representative from Allegan County. I live right by South Haven. So I started out with a nursing career. I got my Bachelor of Science of Nursing when I was 21, and I wanted to work at a really great hospital. So I applied to the one place that everybody said didn't take new grads, and it was Children's Memorial Hospital in Chicago. I lived in the far suburbs out in the country. And my first job was in neurosurgery. After that, and I started having children, then I worked in the emergency room of a level 1 trauma center. I say that because I know what it's like being at a person's home, in an ER room, you know, keeping 24-hour coverage on a patient, and being with that person intimately and finding out the feeling and the fear, and what do you do to make somebody feel more comfortable and confident and educate parents on how to take care of their children. So then I came into the legislature because I love good policy and trying to merge, it's a very delicate dance, what it's like for somebody in those dark spaces to a state of over 10 million people and a $60 billion budget. I've been really blessed to be on health policy. This is my 4th year, but I also chair the Health and Human Services budget, which is incredibly complicated. It's about $32 billion, and nobody come and ask me for any money because it's out the door today. So, but we'll have it in committee next week. But what's that fine balance? There could be a $10, $20, $100 million line item. How does that actually help a child in their home, right? In the dark spaces in an abusive environment, which is their environment. They don't know anything different. So I've really focused these 4 budgets on 3 key things, and that's child welfare, mental health, so that we have early access, early intervention, and then human trafficking. And they're completely connected. These foster kids all have trauma, so they all have anxiety, depression, and they're not getting the help that they need for the most part. If those foster kids grow up without strong supports, they can be exploited and trafficked. Totally connected. And then making sure they have some services to connect it all together. I've heard some numbers that over 90% of people on death row were former foster children. Over half of people in our prisons, former foster children. I think that is truly the biggest issue of our generation that we need to solve, is making sure we have these supports, because these kids go on, they grow up, they don't have good parenting skills, they have children, their children could end up in child welfare, and it just spirals out of control. So whatever I do, I try to make that connection to that child, that person, and even when that child grows up. My daughter-in-law is a former foster child, and I could find out intimately what it was like for her, and that's really important. So that delicate balance and being able to have impact, I hope, at the end of the day, I put it in God's hands. I've just done my very best trying to make those connections, and I give it my all. But that's the biggest things that I'm working on right now. I've got a bunch of other things. I want to go out of the legislature with a bang. I'm terming out in December, but try to leave the state in better shape than when I started, just like a good Girl Scout.
Well, this is a great introduction to the variety of issues. The issue came up on behavioral health, mental health. One of the big issues that has been discussed all day today, and Farrah Hanley mentioned it in her remarks at noon, from the agency's perspective, that the integration of behavioral health and physical health is just one of the high priority, important issues that they're working on. So, and it's in the budget as well. So maybe you all can say a little bit more about that, how important it is maybe, or what the issues are that you're going to be dealing with as you consider that in the legislature.
I'll kick it off.
Yeah.
So 6 years ago, actually 8 years ago when I was first running for office, I found out that was a really big issue. I ended up getting on my community mental health board and trying to understand the intricacies of this very complicated system. And then I white papered a plan, because there's no fairy dust to fix the problem that we have. I mean, we have a workforce issue, so how do we get more psychiatric nurse practitioners, psychologists, psychiatrists, social workers who are ready and willing to take care of the people of our state? Why aren't people getting behavioral health services? The number one thing, it's an 8-month wait to go see somebody. Another thing, so then network adequacy that health plans create, saying there's enough people here to take care of our population. That was something that we worked together to solve in West Michigan. But trying to break those barriers to making sure people get the help they need, we really need to make sure that we've got parity across the state, because there are limits, so that everybody gets the care that they need. Then we talk about workforce. I've worked with MSU and Wayne State to establish a grant program. So for $1.6 million, we can get 35 psychiatric nurse practitioners through a 4-year program. What a lot of bang for your buck, right? And so it's current year in Wayne State, and Michigan State's doing it in my next budget proposal, because they're like, we want in. Did you know it's the new cool career? They had more people apply than they had slots. So I'm working on getting some more funding in and get some more. You know, once people realize that they're wanted, they want to go in these careers. So let's make it cool. Let's make it rewarding. Let's make sure they're getting paid enough. So the finance side is another part of it. Crisis services. We don't have the ability to have it. They had it in other states, so we got that bill signed into law. I'm working on a rapid expansion so that nobody has to travel more than an hour to get crisis services. Psychiatric beds. I was hearing in emergency rooms, they would call hospital after hospital trying to find a psych bed for a person. So let's have a registry, just like the trauma registry. So we got that signed into law. And then the final thing, well, second to final, is somebody having the ability to call a phone number and find someone in their community who can help them right away, or have telemedicine right away. Or a doctor can call and find out where a psych bed is. A police officer, because right now, if they have somebody who's in bad shape, they go to the emergency room or to jail, or the person languishes at home. So we got the Michigan Crisis and Access Line signed into law with the support of all my colleagues here too, and that's being expanded throughout the entire state this year. So my final piece is the public behavioral health system, which has gone from about $2.5 billion to $4.6 billion this year, because it's based on the number of people in Medicaid. We are 650,000 people greater in the Medicaid system than pre-pandemic. 650,000 people. So now this line item is $4.6 billion. What happens when we start getting people off of Medicaid? People, CMHs are having the budgets slashed. So I do have a proposal. I've been working in the state. I don't want to hog all the time right now, but just to have more of a person-centered focus for what we do for our people and not leave people in the dark.
So much. And
So much, sorry.
Well, you covered a lot. Representative Wittwer, what would you add to that discussion? We started off talking about the integration of physical and behavioral health, but workforce, other things that...
So Representative Whiteford and one of the other representatives in the House, Felicia Braybeck, they've been working on this plan, and then there's a separate plan, that standalone plan in the Senate. And I've been just enjoying reading their information and participating in their roundtables and learning about it. But one of the things I think that we need to also look at, my background is communications now, and I've worked in that for 30 years. And I was just having lunch with a group of people, and we were talking about how if you can't see it, then it doesn't really exist. And if you have something that's going on in your head, and people can't see that you have a gash and you have to, have surgery or stitches, then people don't tend to talk about this illness that is actually something they can't physically see. And I think we need to become more familiar and more able to talk about it and have people become more comfortable with talking that they don't feel well. And not just a physical wellness, but a mental wellness also. And we have become a society that is we have been a society that's very hush-hush. We're talking about it more now because when I knock on doors, and I was telling Senator Vanderwaal, I've knocked on 119,000 doors. This is in the top 3. It vacillates between 1 and 2 most of the time. We have people that are on Medicaid and they receive services, or they private pay and they receive services. And then there's people that are on health plans and do other things, and they have a really hard time getting services in a timely manner. So now that we are actually having these conversations and some people are feeling more comfortable, I think we need to continue the conversations and make sure that we do something to make a change, because we definitely have a problem in Michigan with mental health care.
And I'm just going to reiterate, I agree with what they've said, that we have a major problem. I think what really comes down is that right now it's a very complicated issue. We need to simplify that issue so that the person that's needing the help can actually access the help. In so many cases, especially in rural Michigan, somebody can be just on the outside of one of the districts and have to go to a complete different area for service when they actually are always in the one town because that's where they work. And we need to simplify that. We need to make that access much, much easier for those people to get. Same thing goes with the way that the money follows the patient. We need to simplify that. There's no real easy answer. But we know that we have an issue, and we continue to talk about it. But we all need to sit in a room and really figure out what we can do to blend these ideas together, because the true person that needs that service doesn't care what's going on behind the doors in Lansing, Michigan. They just know they need help. And if we're unwilling to bend or to meld different programs together to get that service, we've done a disservice. So as we continue to work, that's the number one goal on our part, is that we've got to simplify that. If this is where they go, and I'm going to use my town, if they live in Mason County, they should be able to go to Mason County. If they work in Mason County, if they live just inside a different district and they have nothing in common with that district, they need to go to where they feel comfortable. And we need to help them be able to attain that service. The other part is we need to make sure that when we graduate people out of our medical colleges with a degree, that we do everything we can to make sure they stay in Michigan. We heard testimony today that 50% of a class right now that graduates usually leaves our state. We can't allow 50% of our students to leave our state. We need to make sure that we figure out how to keep them here. And we've passed bills, the governor signed bills that I think will continue to solidify that and bring more people in. But that needs to be our attention. Simplify and make sure that our graduating students stay here so that we can actually provide those services.
Yeah, Senator Brinks?
Yeah, I think when we start talking about integration, I don't think there's anybody who doesn't agree that there's room for improvement, right? There's definitely ways that we can achieve efficiencies, both administratively and financially, and in terms of continuity of care for people, right? What happens from here up, you've heard this before, I'm sure, what happens from here up should not be separated from what happens from here down, right? So it's a huge topic, and I think everybody has said this already about something today in the short time we've been together, that it's just really complex. And so being able to figure out ways that we can achieve better outcomes and be able to use our dollars, to stretch our dollars farther and maybe save some here and there, I think those are the conversations we are all interested in having, and we have been having to a certain extent. I don't think they're maybe as broad as they need to be in some cases. And it's just a really difficult thing to get agreement on from enough people in the legislature to be able to move something concrete forward really quickly. But we'll continue to try. And I know we've got proposals out there now. There's opportunities to take things from various proposals and combine them. We'll see if that gets traction, but there certainly are big concerns about some of the things that are in the bills that are being considered. So it's something that I have some hope that we could solve as a legislature. I'm not sure we're there yet.
Yes.
I would also add that in taking tours, I know all of us have taken tours of inpatient facilities, but there's a real need for appropriation dollars. I took a tour last year with the leader of the House, and she and I toured a facility that really needs expansion, and then where patients are showing up in our ERs, and ERs are being modified to help with mental health care, and it's not the right place for patients to be, and it's definitely not the place for kids to spend a year in a hospital bed somewhere. So I know there's a real need for appropriation dollars, for one-time dollars to be able to help build out these facilities, and we really do need an inpatient place for some patients. Some patients do need to be inpatient. So I know we all have participated in tours and listened, and I'm hopeful that some of those dollars will come out.
It's like we're at a perfect storm right now, and the House had a proposal last year, the Senate, the executive, on how best to meet the overall, the whole big picture from beginning to end of our psychiatric, the needs of our state, especially for our kiddos. But I look forward to having the ability to take this generational money that we have from the feds and make sure that our great-grandchildren are able to benefit from it. And I think doing behavioral health infrastructure improvements is a really good thing to do. And I just keep pushing that because it's really easy to fix roads, right? It's easy to fix water. I mean, it's expensive, but it's easy. But the mental health stuff, right? I love how you brought up too, we talk about stigma. I think one of the best ways to reduce stigma and let people talk about it is to tell our own stories. And that's been one of my favorite things being on panels, because there's a reason why we're all up here. I mean, we've been touched in some way and understand what it feels like for somebody who is struggling, or to love somebody who's struggling.
Yeah, you used the word struggling. You just brought to mind, Prince Harry has even weighed in on this, you know, and he said, when you begin to talk about your mental health struggles, that was the word he used, you learn you're in a very large community. And that just, worldwide, this issue, the pandemic has really elevated this issue into the public consciousness.
We don't have to keep family secrets all the time anymore. It's
Yeah,
okay.
yeah. So one of the other issues, Representative Wittwer, you mentioned a task force on opioid use and food security and so on, which kind of brings us to the subject of social determinants of health. Mm-hmm. So all of these things, I mean, the goal of the system is to help people become healthier, more productive, live longer lives. And it turns out that healthcare itself is only a small part of that equation. So I'm just wondering if there's anything in what you're looking at in the legislature that addresses food security, opioid use, housing, education, and so on, all of these other things that impact health itself. Who would like to start?
I can hit on the food security part. I know food security, the Food Bank Council and many of the food banks around the state have come to the legislature to increase the funding. They saw over the pandemic especially how many more people were in need of food. So they have addressed that, and they've come to the legislature to see about getting more money into their budget. And then today the governor and the AG released how we're going to spend the millions of dollars of money that we received in the opioid suit that went through. And so that was just released today, and it's multi-pages, or I'd read it to you if you want, but there's only 15 minutes left. And so there are a lot of things done as part of my story. Most people don't know this. I think they're all weaved together. All these things are weaved together. If you don't have food, you know, mental illness is probably right there with it. If you're on opioids, it might be because of some sort of mental issue also. And so if we can just get to the root of the problem, some of this will actually be fixed. I had two nieces die in December of 2019. They were sisters, only kids of my sister-in-law, and they both died from opioid overdoses. And it was a long history of family mental illness. Nobody talked about it, stigma attached to it. I do talk about it all the time because there's been so many deaths in their family over an opioid addiction that is tied to homelessness and, you know, food insecurity and mental illness. And there's a big root of, it's a huge ball that we have to unwind and find solutions to. And I think that's what all of us have been trying to do, is take one part of it. So I laser focus on food security. It's very important to people. It is the most important, food and water. So I very much focus on that issue.
Yeah, and I would add that we've done some things in the legislature to help fund organizations that are really at that intersection of food security and health, right? We have an FQHC in the southern part of Kent County, for example, that has a food pantry, but more than just a food pantry, they offer cooking classes. When the physician or a nurse talks to a family about how to be healthy, how to stay healthy, how to keep their kids healthy, or to someone about how to eat when they have diabetes, they literally can walk 20 feet over and take those suggestions to that food pantry. They have somebody who will shop with them, a nutrition advisor essentially, who will help them figure out what's on those labels and become educated about the nutrition that they need in order to deal with their medical problems. If we could start there before they even have a medical problem, that's the best that's the cheapest healthcare, certainly, is the healthcare you never have to buy, right? So if we could do more things like that, I think we'd be in better shape. I served on that food security task force as well, and I think there are some ideas that have come out of there for both appropriations and some policy, and we may be able to do more on that. So I'm excited to explore that a little bit more. Housing is another issue. We know that housing is a foundation of health. If you don't have a place to live, you're less likely to be able to prepare healthy food. You're less likely to have a safe place to live, and more likely to become vulnerable to other kinds of harm. So we know that's huge for health. And so I've got a bill that would help reduce the impact of evictions on folks who would rent by allowing an expungement process after 5 years in certain situations, just to help people stay housed, particularly families with young children, because it's just such a critical time for human development. It's also a time when many families struggle. They're not as far along in their careers, don't have as great a salary yet maybe, but have additional expenses with childcare and educational needs. So there are things that we can do even if we can't address the whole big picture of integrating mental health and physical health. There are things that we have done and can continue to do to address those things.
I think a common theme was children, because we can actually get positive behaviors begun when they're children. School-based health clinics, and where they can get dental care, vision care. I represent a very rural district, and it's hard for people to actually get their children to doctor's appointments. But if they can just do it at their school, that's key. So I've been focusing on that for years, but now it really came to a pinnacle with the Oxford conversation and making sure the kids get the support where they are. I think we've done a lot of proactive things, or at least we're laying the groundwork during this time that we've been together. And I think all of us have been on opiate packages in some way, just to make sure, it's not fair. I mean, you talked about your nieces. Do we call them drug addicts? Do we call them losers, that they made a choice to die? No, these are family. If we give them a second chance, a third chance, a fourth chance to get recovery where they got the naloxone or the reversal agent, give them another chance to come back, we've got to give every opportunity for every single person who gets hooked like that, because they are loved. And that's something that we can dispel, that myth that people do this by choice. No, they need that early intervention. They could be self-medicating for mental illness and then becoming hooked on something, making sure the families understand what a drug plan is. They know what a narcotic is. They don't just walk away after getting their tooth pulled with a vial of narcotics. And we got a bill package signed into law just a few weeks ago saying you have to have these conversations with people ahead of time, not later. So we're getting things started in the MAP system. I think many of us were part of that too, where we're keeping track of opiates that are being prescribed across the state so that they can get in and get the repeat offenders, the overprescribing, try to get that early intervention.
And I would just add that on a political side of it, because I've never been in politics and I'm older and I'm not going to stay in politics, this is a symptom also of term limits. We have very short terms that they roll through. The most you can stay, like Rep. Whiteford said, is she's done. She's spent 6 years there. And imagine your career and you'd have to know everything in 6 years. It's impossible. So we're being asked to fix these huge systems, and the systems are hard to fix in 6 years. And I know the Senate Majority Leader's been working on a package the entire time he's been here, and I don't know how many years that is, 14 years maybe, and it's still not where we need it to be. So it's very difficult in the current system that Michigan voted. I mean, I'm sure I voted for it, but now that I'm there, I look at it and think it's insane that we think that a person should know everything about the mental health care system in 6 years, and really it needs to be 4 years because it needs to work through the legislature to get through there. And so we have a politics problem also that causes some of these big cumbersome issues like roads to get fixed in our state.
And I'll just jump in real quick, and I agree with everything they said. When it comes, it starts with education and just giving the proper tools to make sure that we can take care of these families when it comes to food security, when it comes to realizing if we have a fellow student that's experiencing an episode, mental health episode. These are all things that we're starting to learn, and we are starting to address. But it is a short term that we're here, and these areas are advancing much quicker in our time frame than what we've ever seen before. And I'll give an example. I spoke to a group of youth and government kids last week, which was really pretty cool, everywhere from 6th grade to seniors. And I asked them a question: how many of you have a friend or know somebody that has had a mental health episode? And every student, along with the teachers except for 2, raised their hand, even down to the 6th grade level. And I'm sure if I would have addressed the food security issue of how many friends do you have that go home on a Friday afternoon and they're not really going to get a substantial meal again until they get back into school on Monday morning, this is alarming. And we've got to figure out what we can do to address that, because we're losing a generation when it comes to education if they're not don't have nutrition and aren't getting direct care.
I think you'd all be surprised too if you had the number of how many kids go without food from lunch on Friday till breakfast on Monday. And I know, as someone who's worked in it a long time, when they delivered the packet to my office, and there's 11,000 people in my district that go without enough food, they're food insecure. And then I talked to Representative Tate, who comes out of Detroit, and 34% of his district, so each district's about 100,000 people, so 34,000 people in his district do not have enough food, so therefore they do not have the correct health care either. It is very alarming to think of.
And we've mentioned roads and infrastructure a little bit, and kind of as something separate from health policy, but it really isn't, because when we start talking about the ability to maintain your health, some of it is your ability to get to and from the drugstore, the grocery store, your healthcare appointments, right? But it also is, when we talk about roads and infrastructure, particularly in cities and municipalities, how we build our infrastructure around us really has a huge impact on how we live. So if we can walk places, if we can bike places, if we can do all those things safely, if we have parks and greenways, which we just did a huge supplemental for to establish those kinds of places for recreating, for gathering, for social activity, and those have a huge impact on your health, right? And so it also reduces some barriers to not need a car, right? Part of our transportation infrastructure money includes public transit. All of those things have a huge impact on health as well.
So I want to say just really briefly about the food insecurity and everything. We have billions of dollars that run through my budget. Billions. So how are we making sure that that money is actually being impactful? I know at one of my schools, the kids threw the food away because it was bad. So I went directly to the school. I said, this is what I'm hearing from kids in your school. The food's bad. But, how is key? Kind of like what I was talking about, that delicate balance between real people and policy issues at the top. Are we actually making that impact? And I think the only way to do it is to pull in our local groups who hand off that food, who prepare the meals, who volunteer and fill up sacks that become the soup that they hand out to the people who need help. So we can't just spend money on it. It's making that delicate balance. And I think we up here have the best ability over anybody who works in the State Department, because we answer to almost 100,000 people and we see what they're going through every day.
So you talk about infrastructure. Broadband has become a public health issue. Thoughts on that?
It always has been.
Yeah, Absolutely. I think we've seen throughout the pandemic the rise of telehealth, and seeing that it can work very well in many situations. We've got great advances in technology that allow people with certain conditions to have certain medical devices at home that can communicate with family members, say, if they haven't been responsive or moved around, or they can have that kind of information transmitted over the internet to a medical professional who's kind of keeping an eye on things from afar. I mean, the potential for us to be able to improve health and manage chronic health conditions for sure is massive. And so I'm really excited about where we can go in the future with that. It will probably take a lot of study, technology advancements, and a lot of trial and error, but I think it will, of course, require policy changes. It's a sea change in how we administer what we do from the government side, but it's also a sea change in how healthcare providers actually provide care. So, to do the balance of to add in what provides better and more efficient care, and to make sure that we're not replacing good care with something less helpful is going to be a challenge. So it's going to take a lot of discretion, and probably a lot of upfront dollars, but I think that there's a great potential there to both save money and provide better care.
Yeah, and we appropriated money in the supplemental that got signed into law last month. The bottom line, it's the last mile. I worked on this issue 5-6 years ago because Allegan County is so rural. There's no business model for extending expensive fiber down to a street that has 1, 2, 3, 5 houses on it. And they weren't doing it. So federal money would come in, it would go to the big guys who would overbuild. So that's why in cities we have really, really good connection, which I'm not gonna downplay that at all, or parts of cities. But we have the chance, and we have a system set up that we can actually do these grants to the last mile with the money that came into that infrastructure package.
We are about out of time, and so I'm just going to ask each one of you, what is maybe the last thing that you'd like to leave with the audience in terms of what the legislature can do or is doing or should be doing to help Michigan be a healthier place to live? Can I start with you,
Sure.
Representative Whiteford?
Let's make sure we have to take care of the people of our state to start, but we really have to put a focus on children and making sure they've got that early access to supports to have the best chance of thriving in our communities and staying in Michigan.
Mm-hmm. Yeah, Representative Wittwer?
We need to work together on good policies that are for the people and for the businesses that support the people.
I think the other piece that we need to continue to work on is what do we do to provide the access? What are we doing to educate each person that lives in our district? Because most people just assume that our hospitals are always going to be there. There's going to be an opportunity. And right now they don't understand the shortage that we have in professionals, the shortage of the folks that need to take care of you if you go into the hospital or if somebody needs to go into a nursing home. We're finally starting to make a little bit of a difference in making sure people are aware of mental health, but we need to continue to make sure that we allow each and every one of you that are in this room to build staff around you that can give us those opportunities throughout the state.
I would say that one area I'd like to see us focus more on, and I think we've had some successes in, is infant and maternal health. We have higher rates of infant mortality, especially among people of color in our state, than many other states. We're not doing well, and we can do a lot better. We have expanded maternal Medicaid from 60 days to 365 days in the budget. We've also made some progress there in terms of approaching the federal government, so look for more good news on that. But I think that's the kind of thing that provides that foundation for all of the rest of the health policy issues that we talked about today. I think those investments that we've made already in expanding that Medicaid coverage to people for that extended period of time is not only saving moms' lives, but it's improving the health of the families that they're in and those children in the household, even not the infant only, but any other children and other members in the household too, by normalizing that access to health care and making that just part of how you do things. And we know that moms have a huge role in the health of every family member. So when they are healthy and know how to access that health care, to your point, Senator Vanderwaal, that health literacy improves for that entire household. And so I think just by expanding that maternal health care for a full year after the birth of a child, we will see benefits that last decades in that household and for those people. So I'm excited to be able to see progress on that front.
Thank you so much for being here today. We are so blessed that you joined us. The people of the state of Michigan are blessed to have you representing them. Thank you so much for what you do for healthcare in the state of Michigan. Please join me in thanking them.